Good day everyone, I am Danica Joy Velasquez, a student nurse at Davao Doctors College, and today I'm going to perform the assessment for the abdomen. So first is the pre-introductory phase, which I will be reviewing clients' previous medical records and doctor sheets of order if available. This is for us to be guided during the assessment. And next is to determine the scope of assessment needed, prepare the necessary equipment, and completeness and organization of our equipment ensures our efficiency as nurses. So the following equipment that we will be needing are, of course, a gloves if deemed necessary, a stethoscope, a small pillow, and a measuring tape, watch with a second hand, a pen light or examination light, and a marking pen, and a examination gown and a examination table. And next is to perform hand washing, don gloves if deemed necessary. This is for us to help deter the spread of microorganisms. Now I am done hand washing. I will just be putting a alcohol. Now everything is ready, we can now proceed to our client and start the assessment. Now for the introductory phase, first greet the client politely and client's companion if around, introduce the self and verify the client's identity. Ask how the client would like to be called during the assessment. Also establish rapport with the client. Introducing the self helps establish rapport, and verifying the client's identity ensures care is being rendered to the correct client. Good morning, sir. I am Danica Joy Velasquez, your student nurse for today. So may I know your full name, sir?
Darl James Tachika,
Okay, your birthday.
June 15, 2007.
Okay, so what would you like me to call you, sir?
DJ.
Okay, hi sir, DJ. So before we start the assessment, we will be conducting an interview. Is that okay with you, sir?
Yes.
Okay. So I will be interviewing your present health history, your past health history, also your family health history, and also your lifestyle.
Yes.
Okay, let's start. So do you feel any abdominal pain?
No.
Okay, no. Do you feel any upset in your stomach, like pain or discomfort?
No.
Okay, no. So how about your appetite? Is it okay, sir?
Yes.
Okay. So are you having a hard time in defecating?
No.
Okay. So let's move on to the past health history, sir. So do you have any history of gastrointestinal disease?
No.
Okay, no. So how about abdominal surgery? Do you experience some of that or trauma?
No.
No? Okay, do you experience or had any health history of UTI,
No.
kidney disease,
No.
hepatitis?
No.
Okay, none of that. Good to know. So let's move on to the family history. So do you have any family member that have or had a GI cancer or the gastrointestinal cancer, sir?
No.
Okay, no. So let's move to your lifestyle. So do you have any diet right now?
No.
Okay. Do you drink alcohol?
No.
Okay. How about smoking?
No.
Okay, that's good to know, sir. So do you have any exercise every day?
No.
Okay. But do you walk?
No.
No, also. Okay. So how about your sleeping pattern? Do you sleep early?
Yes.
Yes.
No.
Do you sleep early, sir? Around 8 p.m. or 7 p.m. or do you sleep late at night?
No.
What, sir?
I sleep late.
Oh, you sleep late at night. So what time at night, sir?
12.
12 a.m. So it's very late, sir. Okay. Thank you, sir. Now explain the procedure to the client and how he or she can participate during the assessment. and providing the client the opportunity to clarify, ask, or raise any concern. Explaining the procedure to the client can help reduce client's anxiety and enhances cooperation, and for us also to answer any questions from our client. Okay, sir. So for today, we will be having an assessment for your abdomen. So is that okay with you, sir?
Yes.
So I'm going to auscultate. I'll be going to inspect you, auscultate, percuss, and palpate you, sir. Is that okay with you?
Yes.
I'm going to expose also some parts of your body, especially your abdominal part. Is that okay with you, sir?
Yes.
So do you have any questions, clarifications, concerns?
Yes. No.
No? Okay, sir. Thank you. Now ensures client's comfort, privacy, and confidentiality. Assessment setting was assured to be safe, secured, and free from any distractions. And position the client to be seated comfortably in Abdomen. Drape the anterior thorax when it is not being examined. Providing for client's privacy protects client's integrity and enhances comfort. And also, after that, ensure that the client has emptied his or her bladder. For the client to be comfortable during the assessment and to avoid any interruption during the procedure. So while our client is emptying his bladder, we must ensure that the room temp is okay for the assessment and prepare the patient gown for us to proceed on the assessment. Okay, sir, I'll be just securing the room. Okay, are you comfortable right now, sir?
Yes.
Okay. Everything is secured, sir. You can now go to the comfort room for you to void or to empty your bladder. Is that okay with you, sir?
Yes.
Okay, you can now wear the patient gown also while you are in the comfort room, sir. Now everything is ready. The patient already emptied his bladder, and already wears the gown. Now first, position the client in a supine position. Place a small pillows beneath the knees and the head to reduce tension in the abdominal muscles. And next is to cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. Covering the upper and lower body parts helps avoid chilling and shivering, which can also tense the abdominal muscle. Okay, sir, can you now lay down? So, sir, I will be putting a pillow underneath your knees. Okay. Sir, can you put your... Is it okay for you, sir, to expose your stomach area? Are you feeling cold, sir? We can adjust the room temperature. Okay, thank you. Now observe the abdominal skin. Note for any vascularities like visible dilated veins or the spider veins. Also note for any striae, which is a stretch marks, and assess for scars, lesions, and rashes. And note the history of scars and document its location by quadrant reference lines. As what I have assessed, there is no such presence of the vascularity, striae, which is a stretch marks, scars, lesions, and rashes. There are no such of the following. The skin of the client is uniform in color with the chest. Now inspect the umbilicus for its color, contour, and location. Okay, so as what I have inspect, the skin tone is uniform with the rest of the abdomen. The client has inverted umbilicus. Now, let's examine the abdomen inspection, which is to inspect the contour, if it's round, flat, or distended. While the client lies flat or supine on the bed, sit beside the client, look across the abdomen at a level slightly higher than the client's abdomen. And next is to inspect the abdominal girth, which is to inspect the area in between the lower ribs and pubic bone, and look for any abdominal enlargement. Stand at the foot of the client. As what I have assessed or inspect, the client's abdomen is flat, evenly round, and symmetrical. No abnormalities were seen. Now measure the abdominal girth using a measuring tape, and at the same time of the day, ideally in the morning. Now ensure that the client has emptied his or her bladder. Sir, do you want to empty your bladder or to void in the comfort room? Is that okay with you, or are you done?
Done.
So are you sure, sir, that you are already emptied the bladder?
Yes.
Okay, thank you. So now position the client in a standing or in a supine position. Client's head may be slightly elevated for orthopenic patients. Then use a disposable, easily clean tape. Measure. If tape measure is not available, use a strip of cloth or gauze, then measure the gauze with a cloth tape measure or yardstick. Then place the tape measure behind the client and measure starting on the umbilicus. Record the distance on the designated unit, which is the centimeters or inches. Then take all the future measurements from the same location, especially for noted distension. Then mark the abdomen with a ballpoint pen to aid in a measuring sign, and ask the client not to wash the mark until it is no longer needed. Okay, sir, can you stand? I will be just measuring your abdominal part. Okay, thank you. So, sir, not wash on. You will not wash it until order natin, sir. You can now go back, sir. Check for symmetry. First, ask the client to raise his or her head to further assess for herniation or diastasis. The next is to inspect the abdominal movement when the client breathes. Then, observe for peristaltic waves. Okay, sir, can you raise your head? Okay. Okay, thank you. Lay down. I have noted that the symmetric movement is caused by respiration. Auscultate for bowel sounds. Use a diaphragm of the stethoscope and make sure that it is warm before placing on the abdomen of the client. Cold hands and a cold stethoscope may cause the client to contract the abdominal muscles, and these contractions may be heard during the auscultation. The next is to apply light pressure or simple rest the stethoscope if the abdomen is tender or painful, and perform the auscultation starting with the right lower quadrant, then clockwise. Then listen to each quadrant for 5 minutes. Minimum is about 1 minute per quadrant for us to confirm any absence of bowel sounds. And next is to note the intensity, pitch, and frequency of the sounds. Auscultate for vascular sounds. Use the bell of the stethoscope to listen for bruits, low pitch, murmur-like sound pronounced over the abdominal aorta, renal, iliac, and femoral arteries.
At alam niyo, ano, tingnan ngayon natin. Ngayong linggo, kung magawa man po, kung magawa man lamang ng itbulaga na pagsamahin sa ng album provider.
I have noted that there is no bruits like low pitch or murmur-like sounds over the abdominal, aorta, renal, iliac, and femoral arteries. Now, auscultate for venous hum. Use again the bell of a stethoscope to listen for venous hum in the epigastric and umbilical areas.
Ang mabubuo nito. Alamin natin yan kasama ang iba pang mga ganap kinamin at kay Alden. Magkahiwalay man, magkasama man, magkaiba man o magkatulad man. Sagot pa rin namin ang mga updates patungkol sa kanilang dalawa. Araw-araw. Bago nga tayo patuloy pa, kaya niyo salamat ako sa mga subscribers natin na patuloy po ang pagsuporta at pagmamahal na binibigay po kanamin at kay Alden na wala po hinihintay na ibang kapalit. Lagi po rin tatandaan na isa niyo po ang buong Pinas show business ngayon sa pagsuporta po kinamin at kay Alden. At kung manood ng mga patungkol sa mga updates natin.
I have noted that there is no presence of arterial bruits or venous humps. Next is to auscultate for friction rub over the liver and spleen. First, place the diaphragm of the stethoscope over the right and lower rib cage and listen for friction rub.
Diba? Kaya nga po, hindi ko naman pumasisi ang ibang mga Alden fans sa pagbubugat na ginagawa nila araw-araw. Talagang daanin po ang tweets nila. No? Para lamang po pang-bugat ang itbulaga. Laging gabi-gabi po, no? May fireworks. Tuwing ako po ay ipapasok at mag-break time ako. 12 midnight o minsan 1 a.m. po ako mag-break. No? Ang bumubugat po agad sa akin, magbubig ko ng Twitter ay yung fireworks. That means mo about Alden again.
I have noted that it has an absence of friction rub, which is normal because friction rubs may caused by inflammation, infection, or abnormal growths. Now, percussion for tone. With the percussion hand technique, lightly and systematically percuss all quadrants. Percussion may proceed clockwise or up and down over the abdomen.
Merchandise. Malamang ang Valorant Philippines po ang nagpadala ng merchandise niyan kay Alden. Yung Valorant po yan, yung online games na nilalaro ngayon ni Alden. And, wait lang, huwag muna po tayo mag-react ng OA, okay?
I have noted that generally tympanic with dullness over the liver and spleen. Percuss the span or height of the liver by determining its lower and upper border. This is to estimate the liver size and determine the next is to determine the lower border by percussing beginning from the right lower quadrant at the mid-clavicular line, then upwards. The next is to note the change from tympany to dullness, then mark the area of the dullness. This is the liver border of the dullness. Okay, sir, I will just liver. Are you cold right now, sir? Okay, thank you. Start. it's around 7 centimeter. Now assess the descent of the liver. This is to assess for liver descent. First, locate the liver border of dullness. Ask the client to take a deep breath, then observe for the descent of the lower border of liver dullness. Then below the costal margin in deep inspiration, and the client hold his or her breath. Then perform percussion and ask the client to exhale afterwards. Okay, sir, can you take a deep breath? Okay, wait. Then exhale. On deep inspiration, the lower border of liver dullness they have descent from 2 to 3 centimeter below the costal margin. Now percuss the upper border of the liver. First, locate the upper right chest at the mid-clavicular line and percuss downward. Then mark the point where change from the upper right chest or lung resonance until liver dullness is noted. So this is the upper border of liver dullness. Then measure the distance between the two marks. So this is the liver span. Then repeat the percussion of liver at the mid-sternal line. Now percuss the spleen. This is to estimate the spleen size. Now first begin percussion on the posterior to the left mid-axillary line and percuss downward. Then note the change from lung resonance to splenic dullness. Then perform a second method of percussion to determine enlargement by asking the client to take a deep breath and start percussing on the last left interspace at the anterior axillary line. Sir, can you do you feel any pain, sir? Can you take a deep breath, sir? Okay, exhale. Okay, the spleen is an oval area of dullness, approximately 7 centimeter wide near the left rib and slightly posterior to the mid. Next is to blunt percuss on liver. This is to assess for tenderness in difficult to palpate structures. First is to ask the client to sit with his back or her back to you. Place the left hand fist against the lower right anterior hip cage. Then use the ulnar side of right fist and strike the left hand. Then note for any tenderness upon percussion. Okay, sir, can you sit down? Okay, thank you. Are you comfortable, sir? Okay, do you feel any pain of that, sir?
No.
Okay. Now blunt percuss on kidneys. This is to assess for tenderness and difficult to palpate structures. First, ask the client to sit with his or her back to you again and place the left hand on the costovertebral angles and then repeat the steps 44 to 45. Okay, sir, you comfortable? Okay, sir, thank you. It's normal, no tenderness is elicited on kidney and liver. Now is the test for abdominal distension or bulging flanks and also for ascites. This is to detect for ascites. And first is to percuss the flanks from the bed upward, then toward the umbilicus. Then note the change from dullness to tympani and mark this point. Then assist the client to turn into the side. Then percuss the abdomen from the bed upward. Then mark the level where dullness changes to tympani. Relax lang po, sir. Okay, sir, can you move to the side? Okay. Okay, so the borders between tympani and dullness remain relatively constant throughout the position changes. Now is to perform fluid wave test. This is also to detect for ascites. Ask the client to place the ulnar side of his or her hand and the lateral side of the forearm firmly along the midline of the abdomen. Then firmly place the palmar surfaces of fingers and the hand against the one side of the client's abdomen. Then use the other hand to tap the opposite side of the abdominal wall. Then note for any fluid movement. Okay, sir, you can put your hand. Okay, thank you. fluid wave is transmitted. Let's proceed to the palpation. First is to detect the tenderness, mass, bulges, or swelling. First is to position the client in a supine position. Then cover the upper and lower parts of the body with a bed sheet, leaving the abdomen exposed. Then begin palpating on a non-tender abdominal quadrant. Then use fingers to compress the quadrant to a depth of 1 centimeter in a dipping motion. Then lift fingers gently and proceed to the next quadrant. Then begin palpating deeply all quadrants to delineate organs. Then use the palmar surface of the fingers to compress quadrants to a maximum of depth of around 5 to 6 centimeter. Then note for any resistance or any deeper structures. Then perform by manual palpations if resistance or deeper structures is felt. Are you comfortable, sir?
Yes.
Do you feel any pain?
No.
In this area, sir, do you feel any pain?
No.
Okay. How about this area, sir?
No.
Okay, so relax. You just need to relax, sir. You don't need to resist, okay, sir? Okay, so no tenderness, relaxed abdomen, smooth, no consistent tension, and no palpable muscles are present. Now is to palpate 4 masses. First is to use fingertips to compress all quadrants to a depth of 1 centimeter in a dipping motion. Then note for any masses, and its size, location, shape, consistency, also the demarcation, pulsatility, tenderness, and mobility. Then note for, after all of that, note for any swelling, bulges, and masses. Okay, sir. Do you feel any pain in this area, sir?
No.
Okay. Okay, thank you. No signs of swelling, bulges, and masses. Now is to palpate the umbilicus and its surrounding. This is to detect also for tenderness, mass, or any bulges and swelling. First is to use thumb and first finger or use both hands to palpate deeply. Then assess for pulsation. In this area, sir. Okay. As I assess, there is no tenderness, relaxed abdomen with smooth and consistent tension, umbilicus and surrounding area are free of swelling and bulges or any masses. Now is to palpate the liver. This is to detect tenderness of the liver. Then, first to stand at the client's right side and place the left hand under the client's back at the level of the 11th and 12 ribs. Then lay right hand parallel to the right costal margin, which is the fingertips will point toward the client's head. Then ask the client to inhale, then compress upward and inward with the fingers. Then after that, note for consistency and tenderness. Okay, sir. Okay, sir. Can you inhale? Okay, exhale. Okay, inhale again, sir. And exhale. Inhale again, sir. Exhale. Inhale again, sir. Exhale. Inhale, sir. Exhale. Now is to palpate by hooking. Stand to the right of the client's chest. Then curl or hook the fingers of both hands over the edge of the right costal margin. Then ask the client to take a deep breath. Then gently pull inward and upward with your fingers. Then next is to note for consistency and tenderness. Okay, sir. Inhale. Inhale, sir. Inhale. Exhale. Okay, inhale. Exhale. Inhale. Take a deep breath. Inhale. Okay, inhale. Exhale. Inhale. Exhale. Now is to test for cholecystitis. Press fingers under the liver border at the right costal margin and ask the patient to inhale deeply. Don't forget to note for right upper quadrant pain and tenderness. Okay, sir, inhale deeply. Inhale deeply. And exhale. Okay. Inhale deeply. And exhale. Inhale deeply. And exhale. Okay. Do you feel any pain right here, sir? No increase in pain is present. Okay, now palpate the spleen. There is two-way method. We do this for us to palpate the spleen to detect for any tenderness. So the first method or the method 1 is first stand at the client's right side, then reach over the abdomen with the left arm and place left hand under the posterior lower ribs and pull it gently. Then place the right hand below the left costal margin with the fingers pointing towards the client's head. Then ask the client to inhale and he should be pressing inward and upward while providing support with the other hand. Then note for consistency and tenderness. So inhale. Inhale, sir. Okay. Exhale. Okay, inhale. Exhale. Okay. Is it painful, sir? Okay, inhale again. Exhale. Okay. Okay. Now for the method 2, ask a client to turn onto his or her right side, then palpate the spleen by moving it downward and forward. Then document the size in centimeters below the left costal margin. Then don't forget to note for consistency and tenderness. Okay, sir, can you turn to your right side? Okay, gently. Okay. Is it painful, sir? No, okay. There is a seldom palpable at the left costal margin, and it is soft, and also it is non-tender. Now, we will be palpating the kidneys of the client. This is for us detect the tenderness of the kidneys. First is to place left hand on the right posterior flank and provided support. The next is to place right hand on the right upper quadrant just below the costal margin at the mid-clavicular line. Then ask the client to exhale and hold the breath briefly. Then gradually release the pressure of right hand. Then repeat the steps for the left kidney. Then next is to begin palpating at the symphysis, pubis, and don't forget to move upward and outward to estimate bladder borders. Then note for consistency and tenderness. Okay, sir. Okay, sir. Inhale. Then exhale. Hold your breath. Okay, inhale again. Inhale again, sir. Then exhale. Then hold your breath. Okay, wait. Okay, inhale again. Then exhale. Hold your breath. Okay. Do you feel any pain in this area, sir? Okay, no. Are you comfortable, sir? Okay, thank you. Okay, inhale again, sir. Then exhale, super. Then hold your breath. Okay, do you feel in this pain in this area, sir? Okay, now. Okay, inhale again. Then exhale, sir. Okay. Assess. It is usually palpable. It is firm, smooth, and rounded. It is slightly tender. Now is to perform the hypersensitivity test. This is to detect for peritoneal irritation. Okay, so the first thing that we will be doing is to stroke the abdomen with a sharp object like broken tip, applicator, or even a tongue blade will be can do. Or grasp a fold of your skin with your thumb and index finger and quickly let it go. Then repeat the steps 102 several times along the abdominal wall. Then don't forget to note for the pain or exaggerated skin reaction. Okay, sir, I will be just stroking down your abdominal for me to know your this is called a hypersensitivity test. So I will be in this way we will know if it's sensitive or not. Is it okay with you, sir? Is it okay with you, sir?
Yes.
Okay. So, do you feel any pain, sir?
No.
Do you feel the pain?
Yes.
Okay. Okay, so do you feel those things that I did, sir? Client feels no pain and no exaggerated sensation. Now is to, we will be testing for psoas sign. This test is for us to detect appendicitis. So first is to ask the client to lie on the left side and hyperextend the right leg of the client. Then note for pain and reaction of the client. Okay, sir, can you move to the left side? Okay, thank you. Okay. So I will be hyperextending this one. Tell me if you feel any pain, okay, sir? Okay. Do you feel pain, sir?
No.
None? Okay, thank you. So there is no presence of abdominal pain. Next, we will be doing a test for obturial sign. This is also for us to detect appendicitis. First thing is to hold and support the client's right knee and ankle. Then flex the hip and knee and rotate the leg internally and externally. Then note for pain and reaction of the client. Okay, sir, tell me if it's painful, sir, or not. Okay, I'll be on your knee. So, is it painful, sir?
No.
How about this one? No, sir? Okay. Thank you. There is no pain and reaction during the obturial sign. Now, test for appendicitis. So, we will be assessing for rebound tenderness by palpating deeply at 90 degrees into the abdomen away from the painful or tender area. So, suddenly, we will be releasing pressure, then listen and watch the client's expression of pain, then ask the client which hurt more by pressing in or releasing. Then ask the client where in the abdomen the pain occurred. Is it painful, sir? There is no presence of rebound tenderness. Now we are in summary and closing phase. First is to help the client to put back in his clothes on and position the client comfortably on the bed. Okay, sir, you can now change. The assessment is done. Next is to summarize the information obtained during the working phase and discuss findings to the client. Discuss the findings of the client with the possible plans to resolve health concern if present. Okay, sir. Now, during the assessment, sir, I have gathered the information about your abdomen. So, while I was inspecting your abdomen, so I have noted that it is flat and rounded, so it is normal. No evidence of enlargement liver, which is really good. Symmetric contour, symmetric in movement caused by respiration, and no visible vascular pattern. And while I was auscultating you, which I was used the stethoscope earlier, audible bowel sound is heard. No arterial broods, no murmurs, no like that. No abnormalities was heard. Okay, and while I was percussing, I have noted that general tympanic with dullness over the liver and spleen, so which is really good. Okay, and lastly, in palpation that we did, there is no tenderness, relaxed abdomen with smooth, consistent tension. There is no swelling or any bulges. That was noted, which is good, sir. So, my advice for your health, sir, is eat healthy diet, have a good eating habits, consume less salt and sugar, continue to avoid smoking and alcohol beverages, sir. Okay, and drink plenty of fluids because this is really important. Also, you said earlier that you don't exercise, even just walking, you don't do that much. My advice for you is to have a exercise daily. Even if it's walking and jogging, it is already really helpful for your body to be active. Okay, and you said earlier that you don't sleep early, right? Okay, my advice to you is you need to sleep early for you to have a good sleeping pattern. Okay, sir. Do you have any questions, clarifications, concern?
No.
Okay, thank the client and end the interview politely. Done aftercare, perform hand washing, to deter the spread of microorganisms. Okay, sir, thank you so much for your wonderful cooperation. The assessment for the abdomen is now reached its final phase. So, you can now lay down, sir. Do you want any water?
No.
Okay, no. So, have a good rest, sir. Here, always remember my health advice to you, sir. Okay?
Okay.
Okay, thank you so much, sir. I'll document findings in the client record using printed or electronic forms or checklist. Checklist supplemented by narrative notes when appropriate. This is to ensure accurate documentation.